Hello, my name is Neil Arwin Mercado, reporter for INQUIRER.net. Yesterday, we spoke with former Health Secretary Manuel Dairit regarding our rapid testing, RT-PCR. We discussed all of this as the numbers, as COVID-19 cases here in the Philippines continue to surge. Yesterday nga, lumampas na tayo sa 70,000 cases. And joining us here today to discuss more about COVID-19 and issues regarding testing and comparing our testing with other countries is Dr. Supachai Basit, Dean of School of Medical Technology in Emilio Aguinaldo College in Dasmarinas. Good afternoon, sir.
Good afternoon. Good
How are you,
afternoon.
sir? How are you? Kamusta ang quarantine?
Uh, we're doing okay here in Cavite,
Mhm,
though our province is still in, I think, GCQ,
mhm,
but
mhm.
we're doing okay and working from home.
Yesterday nga, sir, as I mentioned, nakausap ko si Health Secretary Manuel Dairit. We specifically
Okay.
discussed yung sa rapid testing and how it's not really recommended because the results are usually inconclusive as compared to RT-PCR. So now, sir, I would like to touch on naman yung mga practices ng other countries and we can compare it maybe to how we're doing it here in the Philippines. So, sir, I would like to dive in with my questions now. Let's see let's compare, sir, first how
Okay.
they are doing it, how other countries are doing it, and compare that with how we are doing it here in the Philippines. Maybe we can compare yung mga countries na nabanggit nyo nga before we spoke na who are winning the fight against COVID-19.
Well, if you're going to ask me, I think there are top three countries who could serve as the model when it comes to fighting the COVID-19 pandemic.
Mhm,
Well, initially, I'd like to talk about Taiwan.
mhm,
So, how Taiwan is doing it? Taiwan did not shutter their economy for several weeks in attempt to slow down the virus. So
mhm,
they have this so-called paradigm shift, more of a political will. Um, First, they closed the borders, and then they banned exports of surgical masks. And then the government actually used contact tracing. Contact tracing, and one of the innovations that Taiwan did is that they used SIM tracking to identify, and in order to ensure that quarantine were actually being followed by their citizen.
mhm,
So when it comes to political structure, it is much easier for Taiwan to 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 have this systematic way of what you call this governing or controlling COVID-19 for the very fact that Taiwan has a single payer healthcare system.
mhm,
So that's actually, I think, one of the most important things or one of the most important organizational structure in Taiwan. And they were the first country who have been aggressive in precautionary measures in taking temperature and providing sanitizers before even patrons would enter restaurants and other establishments. The person who leads the fight against pandemic was actually an epidemiologist, or their vice president
mhm,
was an epidemiologist. Maybe that could also be one of the contributing factors. And then next to Taiwan, if you're going to ask me, would be Singapore. One of the things that Singapore had actually done would be among the countries in Southeast Asia, for that matter, Singapore is number one when it comes to testing per number of population. Of course, it is much easier for Singapore to manage because relatively compared to the Philippines, there were only about 5.7 million people in Singapore.
mhm,
But there are things that Singapore did that we can actually emulate because they have this they have because of maybe because of the manageable
mhm,
population, they were able to scan people's IDs at supermarket, for example,
mhm, mhm,
and then they were able to enforce significantly the rule when it comes to quarantine, despite of the fact that if you're going to look at Singapore, most of their populations are migrant workers,
mhm,
and they have this very small confined living spaces. I mean, there are about 20 people living in very small confined living spaces. Yet they were able to of course ensure that quarantine had actually happened. And then next to Singapore is South Korea. South Korea, at the early onset of COVID-19, many people were afraid to go to South Korea because at that time they have a significant, they're actually number two to China at the early onset of COVID-19. Well, they have really this low fatality count, and one of the reasons for low fatality count is that because of the wide scale mass testing. They even have this drive-through mass testing center for COVID-19. And because of that particular widespread massive mass testing, so masyado ng exaggerated yung adjective ko to describe it, they were able to contact tracing much easier, and they were able to quarantine those people who had been exposed to COVID-19. So extensive testing, contact tracing, isolation, and treatment of confirmed cases. So these remain a model. So any countries who would aspire to win against COVID-19 must actually observe this. Continued vigilance, extensive testing, contact tracing, isolation, and treatment.
Of course, these things go hand in hand, Doc. For instance, testing, isolation, contact tracing, all these things go together. But none of those things would be possible if we do not test. And you highlighted enough how important and how crucial the role of testing is. Do we know how, specifically, let's zone in on the topic of testing. Do we know how these countries are conducting their testing?
So basically, anywhere you go in countries, so they have the same basic principle of COVID-19 testing. So like RT-PCR, antibody testing. But then again, each test would tell a different story, right? So of course, RT-PCR remains the gold standard. So they are doing RT-PCR testing. So basically, it's the same for the countries. The thing that actually significantly matters would be the number of testing done per population. The extensive testing really matters. But I could actually understand, because as a medical technologist, it is not really that easy to perform RT-PCR testing. First of all, you need to have a trained personnel. Until last year, we have not included molecular biology in our curriculum. We have this year is the first time that we will formally include molecular diagnostics in our curriculum. Second, facilities. You need to have at least a biosafety level 2 facility in order for you to conduct RT-PCR. And then, of course, again, the availability of the RT-PCR kit and the equipment, the reagent. So these are the factors, and all of these factors, of course, may be solved by having an adequate funding in order for the government to help even private sectors to conduct these tests.
You mentioned the role of the government in doing these testing and all these crucial aspects of fighting COVID-19. Do we know overseas, abroad, maybe Taiwan, Singapore, South Korea, the countries you mentioned, what their government is doing? Are they supporting the tests? Definitely. Are tests offered for free?
I believe in some other countries, particularly if we're talking about the first world countries, yes. Take a look at Taiwan, for example. They have this a very smooth, systematic healthcare system. So, of course, taxpayers have definitely contributed for this particular system to work, but they're able to efficiently direct the funding to concentrate on COVID-19 testing. So, I'm not saying that our government are not actually doing it, but I think if we're going to compare the outcome of the efficiency of a particular country as compared to ours, relatively compared when it comes to fighting COVID-19, they're doing much better than us. Primarily because they were able to appropriately use the funding for a particular problem such as COVID-19.
But in general, sir, the the protocols that we are doing here in the Philippines are the same as what they're doing overseas, right?
Yes, of course. We're following the guidelines of World Health Organization. In
Mm-hmm,
fact, even the guidelines of you wearing mask, you not wearing mask. If you
mm-hmm,
notice at the early onset of COVID-19, there were some advisories that we don't have to wear masks. Then eventually IATF had enforced wearing masks. So
mm-hmm,
all of these were actually we're actually following international guidelines for COVID-19 as advised by WHO.
mm-hmm,
So yes, testing protocols, principles, and even methodologies are the same as
mm-hmm,
compared to other countries. What matters most? Of course, the number of tests being conducted on a daily basis.
mm-hmm, mm-hmm. So one of the things that Secretary Dairit and I discussed yesterday was the yung, how do you call this? What's the term he used? The number of days that we have to wait for a result. He mentioned that yes, the number of tests that you conduct, it matters. But also,
Yes,
it won't be that effective if matagal masyado yung paglabas noong yung waiting time mo kumbaga for the results. Because let's say it takes you 3, 4, 5 days to wait for the results to come out, and then in those 3, 4, 5 days, maybe the patient is positive and nagkaroon pa siya ng possible
contacts.
interactions sa halip na na-isolate
Yes.
mo na siya as early as you can. What is the situation like abroad po? If you know na how many days do they wait, testing time for the results to come out? How long do they have to wait for them to find out if a patient is positive?
Well, I can just understand the dilemma of medtechs in the lab because
Mm-hmm.
if we're going to look at the RT-PCR protocols, they have this cartridge with different wells.
Mm-hmm.
You have to run sample per batch.
Mm-hmm.
Now, if a sample comes in the lab, and of course, samples may not come constantly,
Mm-hmm.
intermittent samples, so you cannot run that test without waiting for other samples because
Mm-hmm.
it's gonna be expensive. You have to maximize the well in the cartridge in order for you in order for you to in order for you to run it. So
Mm-hmm.
other countries perhaps samples come on a regular basis so that they can easily run it on batch constantly. But as far as I've observed here in our country, we have to wait for a sufficient number of samples specimen received before we run it, because we cannot, for example, if it's a 96 well, for example, then
Mm-hmm.
you have to wait for 96 specimen. You cannot run it with just 3 specimen. Otherwise, it's gonna be so expensive, particularly if we're using a cartridge that
Mm-hmm.
has to be run. So yes, you're correct. Um, the number of days, have to be uh, would really be crucial. And another crucial thing is that you cannot just you cannot just collect specimen for an individual who had, for example, recently contact a day, uh, 1 day after he has actually contacted
Mm-hmm.
or interacted with someone who's positive, because chances are it's gonna be false negative. So
Mm-hmm.
at least you have to wait for 2 days. And
Mm-hmm.
yes, you're correct that results have to be released immediately. But
Mm-hmm.
you know, if you are in the actual war zone in the laboratories, there are many factors
Mm-hmm.
that you would be able to consider. Let's say, for example, just recently, or few months ago, there was this personnel in the hospital got positive, and they quarantined significant number of personnel, and that hamper the testing capacity of the lab.
Mm-hmm.
So things like that, and you cannot just hire medtechs
Mm-hmm.
without training in molecular diagnostics. So these medtechs are rare species nowadays because not all would have significant training. So these are
Mm-hmm.
reasons why results are the releasing of results are being hampered. But at the end of the day, the ideal thing to do is to release it as soon as you got the results.
Mm-hmm. So I would like to go back naman po doon ulit sa practices ng other countries. One issue that is still being discussed right now is mass testing. And you mentioned
Yes.
it too. We just like to clarify, it's been clarified before that when we say mass testing, it does not necessarily mean testing every single person in the country? How are they doing it abroad po?
Well, one of the things that we can emulate is to find an algorithm that is applicable to our country so that mass testing would be efficient. And at the same time, when we say efficient, we do it with the testing will ensure that the target population is tested, and at the same time, we do not waste money. So in other countries, they have developed an effective algorithm for 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 a mass testing. So let's say, for example, in some countries, they have this data. If the local transmission is high on that particular area, then mass testing has to be done. And then and the result of contact tracing, the data that you'll get from contact tracing would be also very important in order for you to conduct mass testing. So basically, those people who are exposed, those people who are at risk group, those people who on a daily basis are actually mingling with a significant number of people should be the one to be prioritized when it comes to mass testing. So when it comes to mass testing, we do not prioritize officials. We do not prioritize people who are not at risk group. So at the end of it all boils down to a proper identification of the target population in a cohesive algorithm.
Now let's go naman po doon sa comparison between rapid testing and RT-PCR.
Okay.
We discussed yesterday with Secretary Dairit that in essence, the difference is there's a huge difference between those
Yes,
two
of course.
tests. Rapid test is more on the, it checks the antibodies, the presence of antibodies, while
Yes.
it is the RT-PCR that actually detects the virus
The viral
causing
particle. Yes.
COVID-19. Ang hindi namin na-discuss ni Secretary po yesterday are the other aspects of it that also matter. Let's say cost. Can you, based on your information po, sir, what is the difference between the cost of a rapid testing and RT-PCR?
Well, there is a big disparity when it comes to cost. RT-PCR would cost around, if we're going to get imported kits, RT-PCR testing kits from abroad, if we're going, considering the Forex phase, so it may range between 3,000 to 8,000 pesos. I've read an article, if you know a comedian, Michael V., who recently got infected, in that article, to quote him, he said that he spent around 12,000 pesos for RT-PCR testing. Although he didn't mention how many tests was conducted, but generally speaking, it is between 3,000 to 8,000 pesos. Now, if we're going to utilize, according to news articles, the rapid testing, the RT-PCR kit that was developed by UPNIH, it costs between 2,750 to 3,000. And then if we're going to use the rapid antibody test, the cost would be around 400 pesos to 8,000 pesos. No, sorry, 400 pesos to 800 pesos.
So there really is a huge difference
Yes,
between the two, but
huge
also we want to highlight the difference in their use.
But if you're going to ask for my opinion, having an antibody test may entail additional cost for the patient because at the end of it all, you have to confirm it with RT-PCR. And you have to interpret it with caution. It's very
Again,
important.
can we quickly run through again para doon sa mga hindi nakapanood noong interview natin with Secretary Dairit. Can you quickly run through the difference between rapid testing and RT-PCR?
RT-PCR is an example of molecular test. So it's actually a gold standard, so to speak, when it comes to RT-PCR testing. When it comes to specimen, you will be needing nasal or throat swab. I'll tell you, it is not very convenient, but it's very rapid. Some may utilize saliva, but it may not be as efficient as nasal or throat swab. So it will take several days up to several weeks, depending on the laboratory for you to get the result. The result is typically accurate, but in some cases, you need to repeat the test. Okay. Test will tell us there is an active coronavirus infection, which means the genetic materials of the viruses were detected in your nasal secretions or in your throat. It means that you have an active coronavirus infection. Okay. There is a limitation because it will not tell you whether you had been infected in the past. Okay, so that's for the RT-PCR test. On the other hand, when we talk of antibody testing, you are dealing with testing for two particular types of antibodies. These are the IgG and IgM. Let's see. You know, our body has an immune system. So viruses are considered as an antigen. So anything that is foreign, anything that is not recognized by our immune system is considered as an antigen. So when an antigen enters our body, our immune system will produce two types of antibodies. So the first antibody that will be produced is IgM, and then several weeks after or several days after, you'll be producing IgG. So you'll be detecting IgG and IgM. So is it useful? Yes, if proper interpretation of the test is done. So for example, you've been positive with IgM, what does it tell you? Since it is the primary response of our immune system, IgM will tell us that you have been recently infected. Okay? If IgG is detected in your blood, it means that you had been infected in the past. Is it important? Yes. Since you have been infected in the past, it means that you have had coronavirus.
So you have
and since you have
recovered,
had,
in short.
yes, since you have had coronavirus, it is important to trace those people you had been contact with. Contact tracing is important. But there are people who would be positive in IgG and IgM at the same time. So it's something like they are in transition from being infected acutely onwards to road to recovery. Okay, so the result is much can easily be released between 1 to 3 days. Okay.
If RT-PCR, they are deemed to be more quote-unquote effective than rapid testing as to ascertaining if a person is COVID-19 positive or not.
Yes, active cases.
Why can't the DOH just say that do not do rapid testing? Because a lot of people still have this misconception that I have friends, based on my experience, I have friends who have told me that, hey, I've been cleared of COVID-19 because I've undergone rapid testing. Can the DOH just say that just use RT-PCR, drop rapid testing altogether?
Okay. Rapid testing has certain advantage to a certain extent. Okay, so let's say, for example, in a community where a local transmission is very high, let's say about more than 5%, and people are symptomatic and they do not have immediate access to RT-PCR testing. Okay, then maybe if there are positive for IgM, then local government may somehow isolate, contact trace people who that or contact trace any possible interactions for that particular person. So, however, again, it has to be interpreted with caution because having a positive IgM may not necessarily be a confirmatory test for coronavirus.
Because that
is
could
the
be
reason
other...
why. Yes, because in serological tests, not just in coronavirus testing, even in HIV or syphilis or in flu virus testing, there are chances of you getting false positive or false negative results. That is the reason why it has to be interpreted by a qualified clinician, by a qualified medical doctor.
Let's
So
say,
which
let's laymanize it a bit, sir. Let's say I have colds, simple cold, everyday colds, and I get tested for I undergo rapid testing. Would the rapid test show a positive result or a negative result?
would a rapid test show a positive or a negative result? It depends if you have developed antibodies specific to the one that you're testing. For in
Let's
this case,
say, for that specific
for
test
that specific antibody. So let's say, for
antibody.
example, if you have colds, yeah, if you have symptoms that are similar to coronavirus or COVID-19, and then you've been tested positive, let's say with IgM, if I am a clinician, most likely I would suspect you to be a COVID-19 positive. I said most likely because it has to be confirmed further. But at least I would be able to make an initial step of isolating you.
But it's not
So
conclusive.
it's not conclusive, but at least you know you're able to put you're able to put the first wall of defense. So we're not saying that rapid testing is absolutely useless. They have you have to interpret it with caution and let qualified people interpret rapid antibody testing. When I say qualified people, you know what I mean.
In closing na lang, sir, this interview has been very insightful. In closing, let's again zone in on the topic of testing. What
Okay.
are the things that other countries are doing let's just say best practices that other countries are doing in the context of testing that the Philippines could adapt?
Okay, so again, extensive testing, and then you have to make testing convenient for people. You have to make it convenient for people, and at the same time safe for the clinical lab scientists. So in other countries, they have this drive-through. They're using portalet when it comes to swabbing. They have a designated area for sample collection. Designated area for sample collection. They have been using technology to contact trace people, and most importantly, they're able to develop kits that would somehow ensure that a significant number of population will get tested. So it all boils down to strategizing on how to be able to efficiently done test and at the same time not waste money. So efficiency.
Pahabol na lang, sir, na question. Are rapid testing also prevalent in other countries? Is it also being practiced by other countries as far as you know, or they are focused on RT-PCRs?
Yes, I think it is also prevalent in other countries. Let's say, for example, in Korea, I've read the news article that um, they're doing rapid testing concomitantly with that of the RT-PCR. So they're not totally saying that rapid testing is useless, but they're using it, parallel to the clinical conditions of the patients, and at the same time, confirming it with RT-PCR. So, it's not just your ordinary pregnancy test when a line tells you that you're pregnant or not. It has to be interpreted with cautions. You have to correlate it with the clinical conditions of the patients, and of course, most importantly, history, patient's history.
Okay. Thank you so much. Again, that's Dr. Supachai Basit from Emilio Aguinaldo College in Dasmarinas, Cavite. Sir, I hope you are safe. I know you
Yes,
have a
thank you.
meeting coming up, so thank you so
Yes.
much for giving us a bit of your time.
Okay, thank you very much.
Thank you again. Again, this is Neil Arwin Mercado, reporter for INQUIRER.net. Everyone, keep safe.